Every heartbeat tells a story. Behind every life-saving cardiac or lung procedure is a team of highly skilled nurses. Today, we take a closer look at a heartbeat of operating room, cardiothoracic surgery nursing. Hello and welcome, Heart Heroes. My name is Guirjen, your cardiology nurse here in Germany, and together with my colleagues around the globe, Dr. Edmar Aseberos from the Philippines, Mr. Kristoffer Belaguas from Kingdom of Saudi Arabia, Mr. Jester Catalan from Germany, and Mr. Efren Saldua Jr. from the United Kingdom, we will guide you on this journey through the thrilling world of cardiothoracic surgery nursing. Whether you're a seasoned nurse or a student thinking about your next step, then this video is for you.
Let's start with the basics. Cardiothoracic surgery focuses on organs inside the chest, the heart, and lungs. It includes intricate procedures like coronary artery bypass grafting, mitral and tricuspid valve surgeries, heart transplant, lung resections, and many more. Cardiothoracic surgery nurses are the bridge between surgical intervention and patient survival. They are there to prepare patients mentally and physically, monitor them during operations, and watch over them during recovery. Imagine being the person who ensures that a patient wakes up alive and hopeful after the most critical surgery of their life. That's what these nurses do every single day. From assessing and prepping patients before the operation, assisting the surgeon and coordinating with the team during surgery, to managing care post-op, it's a role that combines technical skills, emotional intelligence, and nerves of steel.
First, let's start with a question. So what happens when a nurse says, I want to do more, lead more, and make even bigger impact? That's where advanced practice nurses, or APNs, step in. These are not just nurses with more experience. They are highly educated, often with certain qualifications, master's or doctoral degrees, and they even work at the very front lines of patient care. Their roles include nurse practitioners, clinical nurse specialists, and nurse educators, among others. Think about this. Although the scope and responsibilities vary in every country, an APN in cardiothoracic surgery can assess a patient, coordinate with the healthcare team, prescribe medications, interpret test results, and even scrub in during surgeries. They are indeed trained to make critical decisions, sometimes in life or death moments, all while keeping patients' care at the heart of everything they do. And their expertise goes beyond clinical care. They are mentors, they are researchers, they are advocates. They even help shape hospital protocols, educate staff, and ensure that patient safety is not just a concept but a live reality. In cardiothoracic care, where the margin for error is razor thin, APNs bring a unique combination of medical insight and nursing intuition. That's what makes them indispensable members of the surgical team.
In cardiothoracic care, seconds can be the difference between life and death. Every heartbeat is significant. Every breath a victory. It's an important where uncertainty meets precision, and that's exactly where advanced practice nurses shine. These nurses are not only clinically competent, they're trained for critical decision-making in high-pressure environments. They excel in situations where every action counts. Whether it's noticing an early sign of cardiac tamponade or making a call to start emergency interventions, APNs are prepared. Advanced practice nurses provide more than technical expertise. They offer trust, empathy, and a steady presence to patients and families. APNs support patients after surgery and help families during recovery. They answer important questions and simplify medical information. APNs combine advanced education with a patient-centered approach. They act as a bridge between doctors, patients, families, and the healthcare team.
Let's break down the responsibilities of advanced practice nurses. First, they perform comprehensive patient assessments, develop and implement care plans, lead code blue and rapid response teams, educate patients and families, conduct and apply research, and collaborate across disciplines. Their ability to connect deeply with patients ensures that every individual feels seen and cared for, even during the busiest shifts, by skillfully leading their teams while also offering warmth and empathy. They create a supportive environment for both staff and patients. This unique blend of skills and compassion truly sets them apart and highlights the profound difference they make every day.
Cardiothoracic surgery is a marathon, not a sprint. From preparing a patient mentally and physically before surgery to ensuring a long-term recovery, APNs are involved at every step. They are not just part of the team, they are the pillars of life-saving care. Our group is honored to have my friend, Mr. Chuck Joel Colas, a proud Filipino and assistant head nurse at the Department of Cardiothoracic Surgery at the University Hospital of Bonn here in Germany, who will be sharing his first-hand experiences and insights as a cardiothoracic surgery nurse.
Hi, good morning. My name is Chuck Joel Colas, and I am currently working at Universitätsklinikum Bonn as an OR nurse in a cardiac surgery, or we call it OP-Pflege here in Germany. At the same time, I serve as the stellvertretende Leitung, or in English, assistant head nurse. My good friend Jhune asked me to share what a typical day looks like for a cardiac OR nurse in a large hospital here in Germany. I work in a tertiary care hospital with around 1,500 to 2,000 bed capacity and approximately 40 operating theaters. 8 of these are dedicated for cardiac surgery, 3 for pediatric patients, and 5 for adults, including 1 cath lab, 1 hybrid operation, and the 3 other theaters is for conventional ORs. And because the hospital is so large, tasks are very clearly divided. And of course, every country has its own processes for patient care. As a tertiary care center, we perform a wide range of highly specialized procedures, from conventional open chest surgeries to minimal invasive coronary bypass procedures with or without heart and lung machine. We also handle all types of valve reconstructions and replacements, whether it is conventional or minimally invasive as well. And cases include complex aortic surgeries too, replacements, stenting, OPs that has to do with the ascending arc or the descending aorta, as well as ROS operations and UFO procedures. The only major cardiac procedure that we do not perform in my hospital is heart transplantation, because here in Germany, heart transplant programs are strategically distributed across the country, and Cologne University Hospital, which is only about an hour away from here, handles these cases. So our hospital is kind of excluded in that. And a typical day for me begins at 7:30 in the morning with a huddle. There we review our assignments for the day, which OR are we assigned to, what procedures are scheduled in the specific theater, and any special considerations for the patient, like allergies or whether it is the first procedure of the patient, or it's a re-OP, and specific preferences of the surgeon. For example, in bypass procedure, if we need to perform it conventionally, an open chest procedure, or a minimal invasive procedure, and whether we need to harvest veins, and if we need the heart and lung machine. Afterwards, we prepare the instruments, ensuring that everything is complete, sterile, before the case begins. And once anesthesia is finished and the patient is brought into the operating room, we are responsible for positioning the patient safely and comfortably. The important is that that the patient will be positioned comfortably for operations that may last 2, 4, 6, or even more hours. When the surgery is complete, we clean the patient, prepare them for transfer to their bed, and then to the ICU. Here in Germany, especially in large hospitals, the responsibility of an OR nurse begins at the moment that the patient enters the operating room area and continue until they leave. We work closely and collaboratively with the surgeons, anesthesiologists, and nurse anesthetists throughout the entire procedure.
Thank you very much, Chuck, for sharing your knowledge and expertise in the field. It really means a lot to us. Now that we have covered the essentials, let's hear from my colleagues in different parts of the world. The questions are: why is there a need for an advanced practice nurse in cardiothoracic surgery nursing? And how can your findings be applied in your own country?
Here in the Philippines, heart disease remains one of the leading causes of mortality. But the sad reality, access to cardiothoracic specialists is still limited, especially outside major cities. Many rural areas don't have full-time cardiac surgeons, and that's where advanced practice nurses could truly make a difference. Imagine being a post-op patient in a province like Samar or Ifugao. Instead of traveling hours back to Manila for follow-up care, you could see a trained APN in your own community. Someone who knows your case, who can assess your condition, and who can guide your recovery. This isn't just a convenience, it's life-saving. For us, the deployment of APNs in cardiothoracic surgery is not just an upgrade, it's a necessity. They can bridge the gap between specialist care and community health care and help reduce the overwhelming strain in our hospital systems.
In Germany, we are fortunate to have already integrated advanced nursing roles into many departments. Nurse practitioners, especially in chronic disease management, play a vital role. However, the cardiothoracic specialty is still catching up in terms of advanced practice inclusion. Cardiothoracic surgery patients often require complex postoperative care that extends beyond the operating room. By expanding the number of APNs in this field, we improve the continuity between surgery, recovery, and rehabilitation. Imagine a patient who has just undergone a bypass surgery. As they recover, an APN can manage their follow-ups, monitor their healing, educate them about lifestyle changes, and adjust medications collaboratively with the surgical team. Surgeons are often pressed for the time, but APNs ensure that no patient falls through the cracks. In the end, it's all about efficient, human-centered care, and APNs are essential to delivering that.
Here in the UK, advanced practice in nursing has grown significantly. Nurse practitioners now prescribe independently, manage clinics, and even lead specialist services. But the cardiothoracic field is a unique case. Patients undergoing heart surgery not only need infection surveillance and wound care, but psychological support and detailed discharge planning. By expanding APN roles in CT surgery, we can give patients a smoother and safer recovery process. Imagine reducing hospital stay by just 1 day per patient. That's thousands of bed days saved yearly across the NHS. And it's not just about efficiency. Patients feel more supported. You have someone to turn to with questions, someone who explains things in plain language, someone who advocates for their well-being. Advanced practice nurses are not just clinicians, they are anchors for patients navigating one of the most vulnerable times in their lives. That's the kind of healthcare we all deserve.
Saudi Arabia is rapidly advancing its healthcare system. As part of Vision 2030, we're focused on improving patient care while building a self-sufficient healthcare workforce. Advanced practice nurses are the heart of that vision. In cardiothoracic surgery, where cases can be acute and complex, advanced practice nurses provide crucially continuity, and they assist with surgical management, guide patients through recovery, and even help train newer nurses. They are the thread that holds the care experience together. We're also a multicultural country with patients around the world. Advanced practice nurses help facilitate communication and provides culturally competent care, something that's just as important as clinical skills. Ultimately, expanding advanced practice nurses' role in cardiothoracic surgery empowers our nurses to lead care, innovate practice, and advocate for patients and families. It's a powerful step forward for nursing and for healthcare in Saudi Arabia as a whole.
Thank you very much to our incredible panel. One thing is clear, no matter the country, advanced practice in cardiothoracic surgery nursing is vital, impactful, and full of potential. So, what did we learn today? Cardiothoracic surgery nurses are the pillars of modern heart care. And when they grow into advanced roles, they become leaders, innovators, and lifesavers. If you feel called to this kind of specialization, you take the first step. Who knows? You may just be the heartbeat someone needs. Thank you very much for watching. Stay strong, stay curious, and keep the heart of nursing beating.